So hi everyone. Our research group presentation today is about, like Rabbi Hanfling just said, maintaining healthcare in the eye of COVID-19. And I, alongside my research partners, Chantal and Shayna, will be discussing this topic, right? Okay, so some background about our research and some of the reasons why we were inspired to have the research question that we did was that the COVID-19 pandemic has greatly affected the lives of everyone, but including children and their parents in immeasurable ways that probably no one or almost everybody didn't expect. And through combinations of feeling this fear of the unknown and uncertainty, and also having to be isolated from friends and family, pediatric groups struggle to maintain their emotional and physical health. And as a result, parents were tasked with the responsibility of creating a sense of normalcy for their children at home. So because of the shift from in-person learning and play dates, etc., to online school and being home pretty much 24/7, parents were really tasked with having to create a safe adjustment for their children. And that's another thing we were hoping to find out about through this research. And our population of interest were families in Lakewood, New Jersey, specifically patients of JMED Health Center. And just for some context, the schools in Lakewood were closed for an average of 5 months. So this is different from states like California, more specifically like Los Angeles. But they were still closed and were in lockdown for an extended period of time and were affected as a result. So the purpose of our study was to research and analyze the ways in which the COVID-19 pandemic has affected children in this past year in an emotional, physical, and academic sense. So not only did we want to discover more about how the pandemic, if it has, how it's affected their children's mental health, but we also wanted to find out whether it's influenced their physical health in any way, and also their education and learning while their school was at home through online learning. And in order to find out about any effects on their physical health, we wanted to look at whether there were any changes in scheduled medical visits and whether they were overall able to maintain their health care during the pandemic. So our thesis for our research was that although the COVID-19 pandemic brought countless changes to people living in the US and around the world, children were able to gradually cope with these new struggles through alternate, innovative ways to continue maintaining their physical and mental health. And so this is what we really wanted to lay the foundation of our research on and hope to expand on in the future. So our points for inquiry and some of the questions that we wanted to ask in our research was, we had 6 points in total that we were interested in finding out about. And so those included whether there were any delays in children receiving their yearly immunizations during the pandemic, what the most common way of keeping in touch with one's pediatrician was, whether there was a discrepancy between telehealth and in-person medical visits, how were families able to keep in touch with their medical provider if they had a chronic illness during the pandemic, and if parents noticed a change in their child's emotional well-being, and lastly, if children's education was impacted during the lockdown. So this is the exact pediatric questionnaire that we used when calling our participants. And so we word for word asked these questions in this order and got some research and data out of it.
So some of the obstacles that we faced while making the calls were unwillingness to disclose personal information, but we were able to assure the parents that everything is confidential, so they were more willing to talk to us. Um, for some cases, it was a language barrier, so we were able to use a language line. There were discrepancies in the experience between LA and Lakewood families, and we had to adjust the questionnaire accordingly. There were also time differences, so we mostly called between 7 and 10 p.m. Eastern Time to make sure kids were put to sleep and in bed and parents could give us their full attention. So now I'm going to start presenting the data. All of the phone numbers and all the information that we had was given to us by JMED, and we made 113 calls, and these graphs are based on those calls. So for the first question, to your knowledge, are you aware of any delays in your child receiving their immunization during the wave of COVID-19? So the first question, we got an overwhelming majority of 83% that got their vaccines on time. For question 2, how do you keep in touch with your pediatrician? 53% in person, 25% said telehealth, and 10% said no contact. For question 3, if you chose the option of telehealth, were you satisfied with the quality of the program? So 81% said that they were satisfied with telehealth for those who chose telehealth in the previous question.
So for question 4, we asked if any of their children had chronic medical conditions, such as asthma, diabetes, or anything else. Were they able to keep in touch with their medical provider for that issue? Out of the parents who responded yes to having chronic medical conditions, again, an overwhelming majority of them said that yes, they were able to keep in touch with their corresponding medical provider for that issue. And then we asked if any of the parents had noticed any changes in their children's emotional well-being. So out of all the parents that we asked, about 77% of them said that they did not notice any emotional changes in their children, but still 23% of them did notice some changes, just probably from the isolation and from all of the changes that were happening. We got a lot of answers such as they're stressed or they miss their friends. So those were some common answers. And then lastly, we asked them that if they believe that while their schools were closed, if their children's education was impacted. This one actually, an overwhelming majority said that yes, it was impacted. And again, this is probably due to such a large change between seeing your teachers every day, being in class, being surrounded by your peers versus having to do school from home. There was a small percentage, the 7%, whose children were too young to be in school, so we decided not to include that in the yes or the no data. So one related study that we found talked more about patient satisfaction with telehealth. The study was based on some pediatric allergy patients. The study found that at first, the patients were not willing, or they were willing, but they were not excited to be doing patient visits from home. They would have much preferred to be in person, but most of the telehealth appointments that they offered were taken up, and after they attended those appointments, they ended up being much more satisfied than expected. So this is very similar to our data on the patient attitudes, because our data showed that of the patients who ended up using telehealth, most of them were satisfied with the program. So some conclusions that we were able to draw, these are definitely not definite conclusions yet, because more research would be needed to create some definite conclusions. But based on our data, some trends that we were able to identify so far are as follows. In Lakewood, most pediatrician visits were continued in person. For most users, telehealth was a viable alternative to communicate with their pediatrician. So as I said, most people who use telehealth were okay with it. Most children were able to receive their immunizations on time. So this means that they were likely going to visit their pediatricians to get those vaccinations. Children with chronic medical conditions were usually able to contact their corresponding medical provider. And lastly, something interesting we found is that parents found more of an impact on their children's education when school was closed than an impact on their children's emotional well-being. So we just thought that that was an interesting comparison, that it probably had more of an effect on their education.
And before we finish off, we have some very important acknowledgements to make. So first, we want to give a huge thank you to Nurse Sue and Shmuel Halpert for their continuous assistance and support in our research and presentation. They were extremely helpful in all ways throughout the whole process, and we feel extremely grateful to have had their support and encouragement. And of course, thank you to Rabbi Handfling, Dr. Friedman, Rabbi Katz, Rabbi Farber, and Rabbi Gruman for organizing this program for us. We feel so lucky to have had the opportunity to have this amazing experience and learn from such influential people. So thank you for giving us the chance to do that. And thank you to all of the JMED research teams for creating a very positive environment and to conduct research in. And we look forward to hearing the rest of the presentations.